Pain dementia is really coming to the forefront now, very much so on the back of the NICE quality standard for dementia, which was written in 2010.
I think it's tremendously important to always think about and talk about pain when we're dealing with people with dementia. It's under-recognised in clinical settings, and I think it's under-recognised in social settings as well.
There is nothing that says that patients with dementia suffer less pain than patients who don't have dementia.
But there must be a lot of underreporting of patients who don't have that high level cognitive function any longer and are not able to articulate it.
The big issue for anybody working with people with dementia is to understand how the person with dementia may well then express that they're in pain.
Often it's not obvious that the person's in pain, and what you're really looking for to a great extent is change, is something changing.
And unfortunately, in the past, a lot of these changes in behaviour have been seen to be what people would class as challenging behaviour.
And so what we actually see is their pain expressed in behaviours that is their way of expressing need, and we don't always make the translation very well.
So it's really important that you use some form of assessment and to think, actually, could this be pain? Rather than thinking it's an increase in the disease process, it could actually be something as simple as a headache or pain in their hip from arthritis.
What we need to do is pick up on those cues and ensure that we are treating the symptoms that the patient have in an appropriate manner.
If you think of the mnemonic pain, pick up on the person's mood, pick up on what changes there are in that, whether it's the distressed or fidgety or agitated or indeed withdrawn.
So looking at verbal cues, listening to, do they have verbal outbursts that perhaps they didn't have previously? Or perhaps were they quiet previously and then make a noise? It doesn't necessarily have to be a word, it just may be a persistent noise.
And one of the things is to just look at them, look at the face. There's lots of research coming out around the fact that facial expressions are a really good indicator of pain, particularly in people with advanced dementia where there's no ability to interact verbally.
And then again, just make sure that for N you notice their body language. So do they seem more agitated? Are they guarding an area? Are they rubbing somewhere? All of those are cues in that somebody could have pain.
It's essentially not rocket science to assess and manage pain in dementia. It's not as difficult as we perhaps first thought 10 years ago, but there are some things that can help us to remember. And certainly I would promote, if you see change in a person with dementia, then think pain.